Good afternoon, and welcome to today's special alumni webcast, Managing Anxiety During a Pandemic. It feels like a title that could be ripped straight from your favorite science fiction novel. And yet, this is a situation most of us find ourselves in today as we hunker down and wait out the COVID-19 outbreak. I'm Derek Kassoff, Managing Director of Communications at McGill's Office of University Advancement, greeting you once again from the safety of my basement, my new home office. It's Thursday, March 26th, and I'm fortunate to be joined today, also remotely, by two of McGill's experts on anxiety, stress, and we hope some coping mechanisms for all of us. We have with us Dr. Tina Montroy, who is an assistant professor in the Department of Educational and Counseling Psychology at McGill's Faculty of Education, associate member of the Department of Psychiatry and the Faculty of Medicine, and director of McGill's Care Research Lab, which stands for Childhood Anxiety and Regulation of Emotions. Welcome, Tina.
Thank you
Dr.
so much
Montroy.
for having me here.
And we have Dr. Jason Harley, an assistant professor in the Department of Surgery, junior scientist at the Research Institute of the McGill University Health Center, and director of the Sales Lab, which stands for Simulation, Affect, Innovation, Learning, and Surgery. Welcome to both of you, and thank you for taking time out of your days to join this alumni webcast and answer some questions from the McGill community. We have received many questions, as you might imagine, in the last 48 hours from alumni all over the world. And we'll try to get to as many of them as we can during the time we have together. Hopefully, people will walk away from this session with some specific actions they can take in their own lives as they cope with the COVID-19 pandemic. But before we get too far into the subject, I'd like to find out a little bit more about each of you and some of your areas of research here at McGill. Dr. Montroy, let's start with you. What are some of the aspects of psychology and human nature that your team focuses on at McGill?
Yes. So thank you first for having me. So a lot of the research that we conduct at McGill involves obviously emotion regulation and anxiety, as the title stands for. I think a lot of our concerns focuses on preventative measures. Currently, we are getting knowledgeable about ways to reverse the effect of anxiety once there is a problem. But a lot of our lab's effort seeks to essentially build resilience from a young age, children, to ensure that in the face of adversity, similar to what we're experiencing now, that we can actually build individuals that are stronger, more resilient, better at coping with adversity. And a lot of our efforts as well is working with parents in better equipping them to become better model, and we'll talk about that later, become better model of resiliency for their children, how to manage and cope with adverse situation such as the pandemic would represent currently. So overall, a lot of our efforts are focused on those two kinds of areas of research.
Great. So in many ways, the entire world has become your laboratory these last couple of weeks, and we'll definitely talk. We'll talk a lot about that, including the children's aspect as well today. Dr. Harley, welcome. I'm not sure I've ever before come across a scientist with a PhD in educational psychology who's posted to the Department of Surgery. Can you tell us a bit about how all that fits together and what expertise you bring to your unit and to the Faculty of Medicine at McGill?
Well, first, thanks so much for having me, Derek. And ultimately, what the goal that my lab and myself are pursuing is how we can harness emotions to help people learn, train, and perform most effectively. In the context of training surgeons and healthcare providers, what we want is for people to be best able to manage all the stresses that are associated with the healthcare system. For patients, what we're interested in is trying to help them do their best to understand themselves and their loved ones, medical conditions, treatment options, etc., so they can help make good and informed decisions as well as follow-ups. And so training and emotion regulation, no surprise, is of course going to be critically important in handling the pandemic as well. So in other words, a big part of what we're doing is to try to help with psychological readiness. And this is really a tool set that in healthcare we need to be doing lots of work on. And so we're happy to be engaged in that work.
Great. Thank you so much. And thank you again for joining us today. We're certainly living in interesting times, to say the least. Dr. Montroy, if I were to ask you to go back in time to find another moment in history where practically the entire population of the world was living under such widespread anxiety and uncertainty, how far back would you need to go?
Well, historically, it's funny because about a few hours ago, the BBC put together sort of a history perspective of pandemics. I think critically, there's been every centuries an episode similar to what we're experiencing. I think this is not a novel thing. I think what makes it currently more of a pressing issue is definitely the aspect of media. So we're connected real time on news all the way across the world. So I think there's more of an urgency, or there's definitely more of a, we're more alarmed by the fact that we're not just aware of what's going on in our immediate sort of geographical location, but we're also aware, we're able to pair what's happening here with what's happening abroad. And so I think that's what probably causes more anxiety currently, even though it is historically something that other generations have experienced. And secondly, I think the other issue is also the fact that we're in an era where we live longer. We are really focused on living healthier, longer lives. We're not as, our perspective of death or how we react to death is, I think, not as, it's less familiar to us. You know, if we look at, for example, pandemics that have occurred 100 years ago, people were, I'm not saying that they were used to, you know, death, but they were, I guess, possibly less reactive than we are now. So tying with certain things that Dr. Harley presented before, it's really, and we're going to talk about that a lot now with regards to how we manage this anxiety regarding the pandemic, it's really a question of perspective. So I think right now we are exposed to more content that fuels the anxiety. And also, I think we are less used to, for example, seeing these kinds of things occurring on a global global platform. I don't know if Dr. Harley would have anything to add to that.
Yeah, well, I was going to sort of maybe ask Dr. Harley to jump in. I mean, so it is clear from your answer that in unless you're 102 years old, none of us have ever lived through anything like this in terms of a
Yes.
pandemic. Again, you know, maybe the Spanish flu, which was pre-Facebook, Instagram time. But Dr. Harley, the fact that we have never lived through any of this, and it is unprecedented, how does that make it even more challenging for all of us to be able to cope with this for the first time in all of our lives?
I think Dr. Montreuil made some really excellent points. And to kind of pick up on one of those, for sure, we're dealing with a huge quantity of information. It's easier for people to create information and for misinformation to not only be created and look more credible, but also for it to spread. And so one of the things that we've been paying more attention to in various scientific and public domains is the role of media literacy and relatedly health literacy. And so we need to be working with patients to provide them with tools to critically evaluate the information that they're using to make decisions about how they, for example, pursue different types of medical treatments or avoid pursuing some. And it's the same thing with COVID. And I know we'll talk a bit about that later. The second part is that we need to be focusing and kind of buckling down and making some commitments with regards to our healthcare providers' professional and personal well-being. This is something, burnout is a huge issue among healthcare providers. And this is something that's important for us to be thinking of as not only those of us in the healthcare system, but also as patients when we go and see our healthcare providers, that it's important for us to try to be empathetic and constructive. And we'll talk a little bit about that later.
Well, in fact, I'm glad you brought that up. I know you did want to speak about that. Let's jump into that right now, if it's all right. This whole notion of healthcare providers, I mean, they are obviously working on the front lines, putting their own health and well-being at risk to in the service of others. And yet I imagine they're also at the receiving end of a lot of fear and anxiety coming from patients or from the loved ones of patients. Tell us a little bit more about what life is like for a healthcare provider now, and perhaps what is it we should be mindful of, and what can we do when we are dealing with them, whether it's over the phone or in person?
Well, as I mentioned in the introduction, a large part of my lab and my focus is to work on emotion and enhancing well-being in the healthcare system, and that a lot of that stems from a large incidence unfortunately an increasing incidence of burnout amongst healthcare providers. And as we know, burnout is associated with emotional exhaustion, depersonalization, decreased sense of personal accomplishment, and the numbers of this have been going up within our healthcare professions. And this is a problem because it reduces the efficiency of our healthcare system, as well as in some cases the retention of our healthcare workers. Of course, COVID-19 is making that even harder. Our healthcare professionals are working really hard to create new medical protocols, to be creative and responsible and adaptive. They're also dealing with reduced staff as some people go into quarantine, limited resources, as in some cases, some things are being hoarded, unfortunately, as well as concerns over their loved ones, their own health, And of course, as you mentioned, when patients are anxious, that certainly makes it harder for us. Whenever we can all probably appreciate that or remember that. When we're feeling stressed, our interactions with other people tend to not be as patient as they might otherwise be, and it's easier to be grumpy and angry. And so it's important that we're mindful of that going into these settings.
So, any specific advice for people dealing with healthcare workers in a frontline setting?
Absolutely. The first thing is that, of course, it's important to acknowledge that we all have emotions and it's okay to be anxious. What's important is that we don't let that carry over to how we're dealing with the people who are trying to help us. And they really do care. Healthcare professionals are there. It's a very vocational job and they care a lot. So please try to, again, it's normal to be anxious. Try to avoid letting that come out in our interactions with healthcare providers because they're also dealing with anxiety themselves. Saying thank you, it's an easy thing to do, and it goes a long way when people are dealing potentially with burnout and increased demands, etc. Showing them that we see that, we recognize and value the hard work and the sacrifices that they're making, that can go a long way and be a highlight of the day in some cases. Following instructions is something else that we can do. There's for non-healthcare professionals, our main job is to make sure that we're following the advice that comes from Health Canada and our governments. And by doing this, that we're doing our part. And that's something as well that helps when we go into hospitals as well, that, for example, we read the instructions. We don't come with, 5 people, for example, for a hospital visit, because then we're going to be asked to only have, one person stay with us. So reading those rules, for example, will help to make sure that everything flows smoothly, and that it reduces also the potential for there to be potential conflicts, for example, with people having to tell you, which is a hard thing, of course, to say to people, to ask them, some people to wait in the car to go back home, and not hoarding resources as well. One of the sources, of course, of stress for healthcare workers right now is working with less materials. Many of us have heard really heart-wrenching stories that have come out of Italy and other countries where healthcare providers are having to make really difficult decisions between, which patient will have a respirator or a ventilator. And so by not hoarding resources, we can help healthcare providers to have the resources they need to help us. And that's certainly to everyone's advantages.
Great. Excellent advice. Thank you for that. Dr. Montroy, I'm going to maybe circle back and ask you a more fundamental question. So I've noticed in sort of, my own circle of friends and in following things on the news, there seems to be a tremendously varied reaction to people's responses to the pandemic. So we've got people who are not leaving their homes to get groceries without suiting up in hazmat suits. And then you've got others, we see all these pictures of people hanging out on the beach in Florida on spring break. I guess my question to you is why is that? And how is it that humans could be wired so differently from one another to respond to crises such as this one?
Yes. Well, it goes back to a point that Dr. Harley brought up, which is the issue of anxiety. Anxiety being a normal emotion. A lot of the times when I see patients in private practice, they come to us and they're like, okay, I want to get rid of my anxiety. And one of the first things we teach individuals is that anxiety serves a purpose. And I've prepared a stress curve to sort of illustrate what might be going on if it can be brought up onto the screen. But essentially what it shows is that, no anxiety or no stress is not necessarily a good thing, because it basically makes us basically indifferent. It makes us sort of not take what's being presented to us by public health as being something that we should abide by, that we should respect, such as confinement. You're referring to people being on the beaches. So most likely these people would be on the latter end, the very low end of anxiety and stress. And so therefore, that's not necessarily a very viable thing, because we're probably putting ourselves and others at risk. By the same token, too much anxiety, which sometimes we refer to as neurotic anxiety or chronic anxiety, will also be, not enable us to be able to make wise decision. We were talking before about the hoarding and, sometimes the harsh behaviors that people have been presenting in the media as well, like with, just at grocery stores, for example. The idea is that too much anxiety can cause irritability, hostility. And so as a result, I think it's really critical to not get rid of all anxiety and not necessarily see it as a normal thing, but at the same time be able to manage. Now, in terms of your question, how come the level of anxiety varies across individuals? I think because we are programmed that way. There's a biophysiological explanation to that, and there's also a more like environmental or a modeling one, which is it all depends how we are born genetically, and so we do know that children of parents who were themselves anxious are more likely to be more sensitive, so have a lower threshold to stress, so be more reactive. And we do know as well that children that are raised environmental also affects and influences is that in our lab studies that is essentially if I have a very anxious parent, I will model those types of behavior to children. And so it's kind of like the combination of the genetic vulnerability or predisposition along with, the modeling that will create a lot of times that variability amongst individuals in terms of anxiety sensitivity. So that's why it's really critical right now to inform parents on the benefits of how we ourselves are dealing with anxiety so that we reflect to our children an image of resilience and ability to cope. So that themselves feel reassured and secured through our own managing of life events.
Great. I will add no personal comments to your parental anxiety piece there. I do want to jump into some of the questions we've received. I'm going to start with one from Jeannie Kavanaugh. I'm going to start with it not only because hers came with a whole bunch of question marks and a freaked out emoji, but because I think it taps into a lot of the fear and anxiety that many of us are experiencing. So here's her question. Every time I have to go food shopping, I take the necessary precautions, mask, gloves, washing my hands upon my return home, but I still fear that I can get COVID-19 when you hear that the virus can live for days on certain surfaces. How do you deal with that? And if you'd like, perhaps before you jump into that, maybe we'll just have that conversation within the framework of the media, because you mentioned that, Dr. Montroy, that this is the first pandemic of this scope in a world of media and social media that we've never had before. And I'm hoping we can get into that a little bit. So I guess to frame Jeannie's question a certain way, what is the solution or the right balance that we should strike between staying informed about what's going on in the world versus letting ourselves be driven mad, by hour after hour of grim news? And can headlines that we read impact our ability to think critically and make rational decisions? I'll turn it over to you guys to answer that.
So maybe, Dr. Harley, I'll just start with just more like what goes on in the brain and how we kind of need to psychologically perceive or deal with what you're presenting. And maybe you can add the piece about how we just navigate through media. So essentially how it works is that one of the precursors or predictors of anxiety disorder, more chronic anxiety disorders, and also the maintaining of anxiety disorders is intolerance to uncertainty. So for example, right now, when we go to the grocery store, we take all the measures. There's a fine balance between, sort of doing what we're instructed to do, like washing our hands, perhaps like coming back home, washing our hands as well, maybe cleaning or, disinfecting certain of the items that we've purchased. But then also the fact that we need to just sit and tolerate a certain level of uncertainty. We never know for sure. So we do know that people that have a greater propensity to deal with uncertainty are probably less likely to be the ones that I was referring to before, to be overboard in terms of anxiety, to be overwhelmed with anxiety. So we have to sort of like accept that, okay, what did I do that's under my control? I can wash my hands when I go to the grocery store. I don't have a choice. They're forcing me to do so. I can wash my hands thoroughly when I come out of the grocery store. Once I get home, clean a few things. But after that, there's a certain level of uncertainty that I have to be able to sit and live with. It's beyond my control. We can't, live in a bubble, essentially. So the more we are able to say, okay, I did what I could do to be as safe as I can be, and there's a certain level of uncertainty, for example, the virus living on the surface a bit longer, that I just have to sort of learn to tolerate. And so the more mindful, the better rested, the better balance I have from reading the news to doing physical activity, the more likely I will be to be able to deal with this uncertainty. There are things, behavior that we can do to have our glass half full or not as full as opposed to being full. If I'm overwhelmed with the media, if I constantly consume it and I have no place for, self-care, most likely I will not be able to deal with this uncertainty as well. And that's why I've made the recommendation in a lot of the interviews I've given to have fixed times, or I've even advised clients of that I'm seeing currently, is saying find or establish fixed time where you consume media during the day, and then dedicate time to other things to maintain that balance.
Hmm. Dr. Harley.
Dr. Montoya had really wonderful points, and I wanted to come back and just highlight too the focus on control. I absolutely agree with that, and I think a lot of the scientific literature on emotion regulation, agrees with that. One way we can think about it is to focus on the present. What can we do right now? And as mentioned again, hand washing, social or physical distancing, those are things that we do have control over. Those are the sorts of things that are going to be productive and effective for us to focus on. Another thing that kind of connects with the media is to try to focus too on identifying things that you might be able to do, and ensuring that the steps that you're taking are in line with, for example, the guidelines from Health Canada and our governments, etc., so that the effort that we're spending learning, reading, etc., is well invested. Some of the things that we need to be attentive to are to avoid falling for psychological placebos. So, for example, it might make us feel better to do something simple like buying toilet paper, but that's not going to help us when it comes with preventing us from catching or spreading COVID-19. So we want to, again, consider what we know, where that information is coming from, and try to evaluate that evidence as well as our understanding of it. There's a difference between knowing something and understanding it. And part of that comes from, can we implement what we think we know? And if we don't, if we feel like we're missing something, it might be a good idea to read a little bit deeper into that. I also wanted, and so again, of course, we have limited, time and energy, etc. Perhaps even less at these times than we would normally, which is okay. So we want to be again strategic and effective with how we allocate that time and attention. With regards to headlines, headlines are deliberately attention grabbing. They want to pull us in. They want to encourage us, to read the article. And that's not necessarily a bad thing, especially when, to have something, jump out at us so that it helps us to direct our attention towards something we might think is important. The problem is when the headline might create so much anxiety that we might not be able to be in a place to critically read the article. So one thing that can be helpful when it comes to, again, reading information online from information sources, et cetera, is to pay attention to our own emotions. Do we notice, for example, when we're reading information, like, are we skimming? Are we skipping over some stuff? Are we just looking, for example, for something specific, the answer, for example, to a question the headline may have asked? If we're reading like that, it might be a good time to just take a step back and to come back to that information a little bit later when we're able to approach it from a more level-headed manner. Similarly, we can, again, ask some good questions as we're reading it. And again, pay attention to our own understanding of it and, again, the credibility, et cetera, of it.
Great. Thank you. Great answer. So here's a question we received from David Sear. I won't describe in full detail the physical conditioning that he outlined for us, except to say that I'm amazed that he's still able to climb 11 flights of stairs at age 75. So kudos to you. He did, however, refer to some chest pain he was experiencing. And he was wondering if this chest pain could be linked to anxiety, which begs the question, can excess fear actually lead to us feeling physically unwell?
Well, I can begin on that. So essentially, I would say I would, as a psychologist, even I wouldn't rule out a medical condition. So you really always have to consider if there's a history of coronary disease or what have you, I would consider that. But on a psychological perspective, most definitely, we do know that panic-related or stress-related symptomatology can include chest pain. One of them being sometimes hyperventilation. For example, it could be also more rapid heartbeat, heart rate, increased heart rate. And those are all very evolutionary in sense because if we do a little study of stress responses, that those responses are all adaptive to prepare us for either fight or flight. I don't know if you recall that from your psych intro class, but essentially, like dilated pupil, really even to a certain extent, like muscle tension, perspiration, all these bodily or what we call interoceptive sensations are related to our body preparing us for one of those two reactions. And so essentially it could very much be that it's related to anxiety. But as anything else, when we're doing kind of an overview or an analysis, we always include or try to rule out any medical conditions in saying with certainty that it is a psychological reaction of the body and the brain.
Great, thank you, thank you. So here's a question from Marianne Barker. She wrote that she has a friend who told her she was having anxiety attacks for the first time, where she suddenly feels that she can't breathe. So the question from Mrs. Barker is, how can we help, support, comfort, or advise our friends and family who are especially stressed during this time?
Well, I think right now, one of the first things we do in therapy for people that come in with these kinds of fears is to normalize, like I just did, normalize the fact that we are experiencing these sensations. We do know there's been a lot of books and there are theories established on that, that essentially what we come to fear is the sensations themselves. I'm really apprehensive to experiencing, for example, hyperventilation. So probably what the person is referring to with difficulty breathing is that over time, if there's a lot of hyperventilation that comes from increased heart rate, if we've all been, let's say, on the scene of an accident, or we've almost gotten involved in an accident, we suddenly have a rush. Like all of a sudden we have difficulty breathing, our heart is palpitating. And so most likely what she's describing comes from or is symptomatic of a stress-related response. And so one of the first things that we do is that we try to really decatastrophize the experience of those sensations as being normal bodily reactions to stress. So your body is actually evidence that your body is actually, and your brain is perceiving a situation that might be dangerous. In this case, it's not necessarily as dangerous as one might think, but it's our body working naturally. And so one of the first things is to essentially be able to accept and normalize. And another thing that we do, which might require the assistance of a psychologist, is that we basically induce these sensations in office through various physical activities. And over time, what we want to do is by repeatedly exposing the individual to that, little by little, there's habituation and therefore desensitization. Or so the fear essentially doesn't become as foreign. It becomes like just a normative thing. So there's a work to do at a cognitive level, saying, okay, these are just very normal. My body's just reacting naturally to it. And then more behavioral things that we can do in inducing these sensations and making the person less reactive to them. And so usually that will require the assistance of a trained psychologist to be able to do that with the individual, but it's quite effective.
Dr. Harley.
Those are really wonderful points, Dr. Montoya. Some other things we can do in a non-clinical setting, I think are when we're speaking with friends, family members, etc., we can try to, again, remind them because one of the things that's happening a lot that I've noticed too is people are speculating a lot. And that's a normal, natural thing. We want to kind of try to predict what might be happening. It gives us a sense of, I think, of control to run through some different scenarios, etc. But when we're spending all our time, or too much of it, in conversation with others about what could happen, etc., and especially if the predictions that people are coming up with are all negative, that's going to create just a vicious cycle of anxiety. So it can be helpful when we're chatting with people. As Dr. Montoya mentioned very appropriately, it's important to acknowledge and normalize those emotions, but we also want to take some time to talk about something else, to bring the attention elsewhere. Talk about the book you're reading, the Netflix show you're watching, the new K-pop band that you discovered that's making you happy because it's so energetic and talking about cake, etc. Those are some things that can be helpful. And one of the reasons they're helpful, aside from shifting the attention of both yourself and the other person, is that especially if it's a video conversation such as this, we pay attention and we're really attentive and attuned to the emotions of other people, facially, behaviorally. It's one of the channels. We've talked a good amount, a little bit about the physiological output of emotions, which my lab has done some work as well, looking at skin conductance, heart rate, etc. But behavior is also a really important way that we express how we're feeling. And so when we're expressing to others that we're anxious, which we might be doing if we're starting to shift and focus into an hour of post-apocalyptic thinking, switching to talking about something that's lighter, maybe more fun, they're going to see, the other person's also going to see that in our behavior, in our posture, in our smiling. And this is going to help them also to relax a little bit, as well as ourselves.
Great, great. And I promise you when this is over, we will have you back, Dr. Harley, to do a special episode on your favorite K-pop bands. I promise we'll
I have a few.
a short webcast. So here's another question from Karina Perez Ivostova. So she writes that she lives in Mexico, where the spread is just starting, but I have friends and family in Europe and Canada, where the emergency is in a more advanced stage. I feel they are more anxious and in need of support. All the while, I'm anxious and scared because I know I will be in their situation in a few days. What can I do to be supportive, yet take care of my own mental health? Dr. Montroy, I think you...
So it goes back to a few points that actually Dr. Harley mentioned, which is essentially right now, I think our tendency in such a case is to assume that the same outcome will occur, let's say in Mexico, as we've seen elsewhere. There's always a chance that, you know, measures being put in place that are different, maybe more preemptively, that it might change the course of events. So it comes back to the importance of living in the present moment. So for example, today, what can she do to better prepare herself in the face of whatever may come about, and ensure that essentially, again, connecting one of the points of Dr. Harley, that there's caution in making sure that the exchanges with her family members are not solely focused on more, like you're referring, apocalyptic elements or catastrophizing issues, but really also focus, and I think that's what the media could also possibly play a role in, not just highlighting, and I know there is an effort, but not just highlighting the more catastrophic outcomes, the death or the increasing number of cases with COVID, but also depicting a picture of resiliency as well, of what's occurring across the world, that there are positive things. There are people that are remitting. There are people that are improving. There are people, for some reason, even though they may have come closely in contact with certain people, that are not necessarily developing complications as a result of the viral infection. And so I think that's kind of the few things I would recommend as caution, but also, you know, ensuring that, you know, there's a balance, that she can engage in other things that will make her happy, which will, we didn't talk about that, but will boost also her immune system. Because the more we worry, the more we fall in that kind of like right hand side of the curve where there's too much anxiety, we're also suppressing our immune system's capacity to essentially fight viral infections for us. So it's not just cognitive, it's not just psychological, it's also very much biophysiological. So there's an incentive to really live a day-by-day mindful life in order to just be more resilient, not just cognitively, but also physically.
Dr. Harley?
And I very much agree with those recommendations, especially that there are a lot of amazing stories of resilience and of hard work. And for sure, you know, it's been amazing to see my department and colleagues, you know, pulling together, bringing new protocols, identifying needs. The communication, the collaboration that's been going on is really inspiring. And so those are things that I think we don't always hear about, all the hard work that's going on within the healthcare system to identify, you know, and adapt to everything that's changing, and to make, you know, really amazing efforts to also communicate those things, you know, to the public. And our governments are working very hard as well to share information, to put responsible policies in place. So there are, while it's a challenging time, there's also a lot going on where people are working really hard, being creative, being collaborative, and in a way that's also really encouraging to see. In some ways, it's while this is a challenging situation, there's also lots of examples of people coming together, and, you know, the strengths that we can have as a society and as individuals.
Great, very, very well said, both of you. So I know many of us are now obviously under, you know, your orders or strong recommendations to spend most of our time at home and maintain social distancing, and yet humans are by nature so strength and comfort during times of hardship. So Dr. Montroy, how is this self-isolation and social distancing compounding our ability to cope with the current situation? Don't you just want to give someone a hug?
Yes, exactly. So it is essentially compromising our ability to get that physical sense of comfort. By the same token, I think it's an opportunity for us. Again, I know sometimes people say, "Oh, it's so idealistic," but that's really the cognitive or the psychological tendency to be resilient, is to try to always find something positive from the adversity we're being faced with. And so right now, yes, the physical contact is limited for a lot of people. However, there are opportunities to connect via, we're very fortunate being able to connect via social media. We can connect via phone. Maybe some of us, I was telling some clients, like some of us are so overtaken by our jobs and our careers and everything else that we're managing, that sometimes finding time to really feed social connections with people that are meaningful to us has been quite difficult. And this is an opportunity right now, a forced opportunity with confinement, to be able to re-engage and reconnect with some individuals that perhaps we wanted to reconnect for quite some time, and that we haven't been able to. In terms of the question of social support, tons of evidence provide evidence for the benefits of social support when it comes time to being psychologically resilient, right? We know that. But at the same time, what I'm also seeing is that in parents dealing or having difficulty dealing with their own anxiety, some concerns have arisen that sometimes parents can become overbearing, overly involved, overly invested. And so it's critical as well to know that too much investment, too much support, even if it's positive support, can also lead to intrusiveness and essentially, trigger even more so withdrawal when there would be, or isolation when there could be opportunities to connect. So it's very critical at the same time to take care of ourselves. So the level of support that we're providing is adequate, leaves room for the other person to actually also live their own individual life. And that doesn't include children, obviously, but I'm talking more of parents, of teens, younger adults, older adults. And so to be sure about that as well, that social support is adequate.
Great. So on the question of sort of being socially distanced and in a work environment, we did receive a few questions about remote work. Let me jump to one here from Cheryl Hones. She says, I hope I pronounced that right. She says, I manage a workforce of 10 people, which has always worked remotely, each of us from our own homes. I'm beginning to see signs of stress, argumentativeness, and insecurity. I wonder how you would suggest dealing with this in such a setup. We generally have staff meetings every 2 weeks, which I've increased to weekly. Any other thoughts on that? Dr. Harley?
That's a great question. I think one of the ways that we can deal with that is especially to focus on and being mindful in terms of how we're feeling, so that again, it's normal for people to feel anxious, and therefore for people's tempers potentially to be shorter, their patience, etc. But when we're mindful of how we're feeling, that puts us in a better position to avoid having that emotion spill out over other people. And then as soon as that happens, again, things can, if you're upset and then you're grumpy with someone, and then that makes them grumpier, and then you kind of get into a circle of grumpiness in a workplace, which isn't necessarily very constructive. Another thing you can do is to really focus on expectations. Expectations are a really important part of motivation. And ambiguity, and there's a lot of need for changes and for clarifying expectations, and ambiguity can become an incubator for anxiety and for stress. So it can be really important to focus on how things are affecting deadlines, workload, availability for online meetings, etc. And to have those discussions as often as they're needed, potentially, and to set goals with employees, potentially in a collaborative sense, so that people know what everyone's constraints and affordances are in a situation. And that probably will also help avoiding situations where work doesn't get done or expectations aren't met, because as many people as possible are making informed collaborative decisions. And again, collaborative work and communication are really important things that are going on in the healthcare system. And again, I've been so impressed with the interprofessional communication going on between surgeons and anesthesiologists and nurses and people working in the administration, to make sure that everyone understands and everyone's on the same page. And that's such a critical part of us managing and doing our best, not just to get the work done, but to remaining kind to each other.
It's interesting you mentioned that grumpiness can be contagious as well. So we have a second curve that we need to flatten there as well. But let me ask you about the question of routine. How important is routine, either for those of us who are working from home and trying to manage our jobs and our work responsibilities, as well as those who are currently out of work because of the pandemic and are not used to being not busy? How important is routine to both of those situations, Dr. Montroy?
Quite important, actually. I would think we're going to get to the question of children in a second, but definitely for children, but also for adults, because I think we do know that the more time we have on our hands that is unstructured, the likelier we will be to worry or to fall into worry, especially if we have, again, a lower stress sensitivity and we're more susceptible to anxiety. So therefore, really, like, so I want to going back to one of the items of like having fixed time. If it's like in the morning, checkpoint, look at the news media sources, reliable sources, and then maybe like later on in the day, and then really schedule specific time for well-being, either exercising, it could be, taking a walk, it could be, but really having a schedule helps us replicate. Again, in that question of control, there are things we can't control, like we can't just go out like we wish we wanted to. We can't go back to work, but we can organize our day in a fashion which is much more predictable, which somewhat replicates the structure that we would normally have in a work setting. And so that really helps, I think, like again, with the uncertainty, kind of having a fixed schedule helps me think ahead of time what I'm planning for, but at the same time, not being too rigid that if I don't get, especially with having kids at home with for a lot of us, not having or not being able, like again, these expectations that Dr. Harley was talking about, having the flexibility that if, let's say, even though I have a schedule, if not everything is met as I had intended, having that cognitive flexibility to say, you know what, like right now, given my circumstances, I was intending on it working, but I didn't necessarily meet. And so being flexible with not being too hard on ourselves if we don't meet all the objectives, but definitely
Mhm.
having that set routine. And the same applies for children. We do know with children, for them right now, it's a huge shift because they're used, for the most part, most of them being in an environment that's highly controlled, highly more like structured in terms of activity. They know ahead of time things, usually they all have the same routine that replicates, they internalize it, and all of a sudden they find themselves in an environment where there's no more restrictions, no more structure. It's very disconcerting for them. So to really help
Mhm.
children and indirectly and selfishly help ourselves as parents working home with children is by establishing that kind of routine, we can also help them, create a little bit of predictability, and so therefore kind of reassuring them in these uncertain times.
Great. So I do actually want to get to the whole issue of children. That was actually next on my list. So it's a good place to maybe jump to that. You've answered some of the questions, but here's one that we received from Jas. She was wondering, how can individuals with younger children best communicate the current situation to them without instilling fear or worry, but still ensuring that the children take it seriously?
Maybe I can chime in, and maybe Dr.
Mhm.
Harley can fill in my blanks. So essentially, there are great resources out there, both in French and English, some of which our department at McGill, our program more specifically, School of Applied Child Psychology, will recently or soon be making available, as well as on our lab website. We will have parental be directing them towards these kinds of resources. But there are a lot of French and English resources out there that have been created for all ages on how to explain what's currently happening to children. I think the worst thing to do is just to pretend, oh, they're young, they don't get it, we're not going to talk about it, we're going to pretend as if nothing is. I think that's really false. Of course, like, if you have a 2-year-old, a 1-year-old, you're going to adapt. And I think in those cases, it's more how I'm reacting to, how I'm behaving in my environment that will be more critical for them. But definitely with kids that are verbal, that have a certain level of conceptualization, that they can think, there are great resources out there. For example, I saw one this week produced by the government of Quebec, which essentially in a cartoonish kind of a way, it's presenting, for example, what is coronavirus, how it's similar to other viral infections, how it can impact and make us ill, and at the same time present to the children and really focusing on why it's so critically important. I've done that with my son, like really to kind of not just say wash your hands, but why is it important to wash your hands? And so children come to internalize why it's important. Again, it makes them know what is going on, and therefore I think reduces their sense of not having control. Like we present it as washing your hands, coughing in, for example, in your arm, in your elbow, arm, and then other things that you can do, like for example, right now, social physical distancing can actually increase our likelihood or resilience in the face of an infection. So I think all those things are ways that we can present to children, and we don't have to just rely on ourselves to do it. There are great resources out there if we Google and we search the internet on how to do it, but also support us in our explanation of what's going on.
Great. So Dr. Hartley, before you jump in, maybe I should just mention that in addition to your research work, you're also an author who's written a comic book for children called Fake News and Dinosaurs. And I think we actually have a copy of that we can display up here. Can you tell us a bit about that book and your take on dealing with children in situations of stress?
Absolutely. And I agree very much with everything that Dr. Montoyo said. It's so important to include children in our discussions about what's going on, and for children also to have some resources that they can approach and better understand what are emotions, how can we think about emotions and the impact they have on our behaviors. And in particular, the book that my partner and I created, Fake News and Dinosaurs, was intended to really help children understand the connection between emotions, emotion regulation and things they can do there, and how they go about consuming information, and especially tips and tricks to avoid fake news. And so when we think about that in the context of COVID, that's certainly relevant as well, because there are lots of ineffective strategies that we hear lots about, the hoarding of toilet paper and et cetera. So this was one of the things that is important, as Dr. Montoyo mentioned, is that when we're talking to children and sharing information with them, it's really helpful for things to be fun. And so the approach that my partner and I took to this was to create a comic book rather than kind of a text-based thing. And so we have pictures of dinosaurs. It's set in what's called a secondary world. So it's a world populated by dinosaurs that talk and think and interact with each other. And the story is very much has an arc. It's a mystery novel or mystery comic book where these two kids have to come together to figure out, what's really going on in the town where there's all this fake news being propagated. And so it's fun, but it's also educational. And so that's something that people are certainly welcome to Google and have a look at. We've gotten really great feedback about that. Again, that's called Fake News and Dinosaurs.
And just on that cue, I see Dr. Montoyo, one of your kids has made a cameo appearance in the back. Maybe they want a copy of the book.
The BBC footage. I just don't have a nanny to pull him out. But
the timing was impeccable.
It's great because then it just normalizes the reality of many of us parents right now. But I would just add as well on the issue of emotion regulation. We also have a great book which is called Healthy Minds, Healthy School that we've been presenting in schools as well, which also again is to build resiliency in children, and that's available on many websites as well. And so the goal here is to present in a very fun way activities on how children can be better accustomed or better connected with their emotions, be more mindful, and how they can actually have control over some more negative thoughts that sometimes are intrusive and affect their overall mood.
Mm-hmm. So I'm being a bit mindful of time. We are 10 minutes to the top of the hour, but I do have one final question that came in from a parent of an older child, young adult. I'll leave her name off, but she's saying that she's a parent experiencing disbelief, frustrations, and worries about my young adult son's decision to stay abroad. What would you suggest is the best communication strategy with a person who presents as invincible to the impacts of the pandemic and who may not have the full mental capacity to evaluate his situation entirely? Dr. Montoyo, I think you want to jump in on that one?
I can follow up with Dr. Hartley if you wish to begin. I think it connects a little bit with what we said before about social support, right? I think our job as parents, especially in this case, we have an adult child who's essentially independent, autonomous, and able to make their own decision. I think our role as parents is to really kind of psychoeducate, provide, for example, the rationale on how to remain safe. But it goes back to what I was saying before with social support, is that sometimes in us having a hard time, accepting that the feedback we're giving is not necessarily taken. One of the things we say is that if we provide feedback to someone, if we provide, for example, advice, we have to accept that the advice may not be received. And so that's part of giving advice. The other thing is that once I give advice and I do provide social support, I kind of have to create a distance in respecting how the other person will decide to use the information that I've provided. And so just be cautious a lot of the times of how I'm managing my anxiety, because if I'm not managing my anxiety properly as a parent, I can sometimes kind of become more intrusive, more overly involved in controlling sometimes decisions of an adult or teen child, which can create more of that distance in the end.
Great, thank you. So once one of my neighbors said to me the other day, once this is done, we're all going to need therapists. So as you look towards sort of the back end of this pandemic and getting on with our lives, are we in fact going to be facing a situation where post traumatic stress disorder becomes a common occurrence for many of us? And is this really going to have fundamentally reshaped the way our societies sort of function, at least in the short and midterm?
You were taking? Oh,
Mm.
you were taking.
I think one of the things that we want to be mindful of is, and especially thinking about, and this could, this is related, of course, to burnout in our healthcare professionals. That's the angle I'm going to approach this from. This is where it's really important to try and be as as patient and kind and informed as we all can be, to follow those instructions, to thank our physicians and healthcare workers, and also to look at ways and this is an area of research that my team and I are looking at exploring. How can we support healthcare workers and avoid, for example, having people burn out, having people be faced with challenging situations that are hard to control? What kind of psychological support can we provide people, and how can we enhance the safety and well-being and perception of that within our healthcare facilities? And so those are things that we're working on right now, and that's definitely, I think, a big piece of the picture. And I'll turn that also over to Dr. Monsueo.
Who's been joined by a guest.
I guess, yes, my 2-year-old. And so I don't think I would have anything much to add to Dr. Harley's comments. I think it was well addressed.
Okay, so let me move to this next question. I'm kind of hopeful. I'm happy to get to this one. Are there any benefits or bright spots to this period of self-isolation and all of this so-called downtime that many people are now dealing with, that we may want to kind of look towards as maybe a silver lining in all of this?
If you don't mind me jumping in, so it kind of goes back to what I was saying before, right? It's like a way for us to be able to look at this situation under a different lens. It's all like really in the eye of the beholder. It all depends the perspective that we hold on this. Some of us can look at it as a loss of privilege, a loss of control, a loss of the ability to make our own decisions and go about our days as we would want it to be. But we could also look at it as an opportunity to actually reconnect with certain things that perhaps we've been feeling guilty about not being able to do. Like not being able to hold our 2-year-old in the midst of work. And this is now an opportunity that we have to reconnect, maybe for parents, with our children, spend more time with them. I have said it before in other interviews, where if you, for example, a simple activity as knitting or anything else that you've wanted to do in a very long time and haven't had the time to do so, this is a great opportunity through this social isolation to perhaps reconnect with those kinds of things that not only we enjoy, but actually do something good to us psychologically and mentally.
Dr. Harley, anything you want to?
Yeah, and maybe to add on to that, those are excellent points, and I absolutely agree with all of those comments Dr. Monsueo made. Would be maybe again thinking of this highlighting the importance of the role of emotions and how people again consume and understand information. One of the challenges that people have when consuming information is some of the cognitive biases that we have. So, for example, and this might apply to one of the past questions, we can fall into sometimes kind of rigid, patterns of thinking where we're much more attentive and receptive to information that conforms to what we think or what feels emotionally satisfying, to do. And so by understanding that, again, emotions play a role and interact with some of these cognitive biases, that's a helpful starting point for some of the interventions that we can offer, but as well as for the general public to have a bit of a better insight into their own decision-making processes. I think this is also an opportunity, and there's been a lot of changes and discussion of changes, and this is something that's starting to roll out about adaptations that we can make to our healthcare system. And one of those opportunities would be with telemedicine. And so providing, for example, more triaging for patients to help relieve the burden on clinics and hospitals, etc. I think it's also could be an interesting idea to explore the role that telemedicine could play in providing support as well for physicians and healthcare workers who might, for example, a hotline for them if they've just come out of the operating room and things didn't go as planned and need to take a moment to recuperate. Having a number to call, that could be a helpful thing to do. There's also a lot of roles that other types of technology can play in enhancing people's psychological readiness to deal with stress. There's a lot of work that we're doing in the simulation setting world, where we're providing people with interactions with high fidelity actors or mannequins that can better simulate what it's like psychologically to be in that situation. And there's work that my team and I are doing on moving some of that simulation work into virtual reality, which can be even more immersive. So there's a lot that we can be doing, and a lot that we're starting to move towards in different areas and sectors of the healthcare system. And so, as I said, I see a lot of opportunities there, and I think opportunities that might be better recognized or better highlighted, especially for the general public, from this particular pandemic, so that we're ready for future health situations.
Great, thank you. So we're just about out of time. Any last words from you, Dr. Montroy, before we sign off?
I think quickly what I would like to add as well is that I think, we are really pushing towards more prevention. And so I think if we had more access to psychotherapy and a preventative approach, maybe we might have people that are just better able to deal with these difficult situations currently. So I think it's something to think about, being less reactive and more preventative.
Great, thank you. And I see you definitely have your hands full in many ways.
I definitely do, but that's okay.
Great. Well, that does just about wrap up the time we do have today. Before we conclude, I'd like to remind everyone that this video will be available at this same link very soon after our recording ends. So feel free to share it with others who may not have been able to tune in live. Please keep watching your email and social media feeds for more information about our next webcast. I will be right back here in my basement office 1 week from today, Thursday, April 2nd, to look at the economic and labor implications of the pandemic with two incredibly talented professors from McGill's Faculty of Arts. As always, McGill remains committed to providing you with the news and information you need to stay safe and to stay informed during these challenging times. And finally, I would like to extend a sincere thank you to Drs. Montroy and Dr. Harley for joining us today and for sharing some incredible insights with all of us. I do hope we'll have a chance to connect again soon under more pleasant circumstances. And thank you, McGillians all over the world, for tuning in. And let's all work together to flatten the curve. Thank you.
Thank you.